I want to talk about a few complications you might have when breastfeeding. Let's talk about engorgement first. A lot of women are concerned if they don't have engorged breasts, their baby isn't getting enough milk. It's a common misconception, so I'm going to explain it here. Engorgement is not a good thing. When you have engorgement, you have breast tissue compression, which leads to breast milk suppression. Let me give you a real-life example of what I'm talking about. You deliver your baby, and you're breastfeeding on cue from day one. Your baby is now 3 days old, and he has some jaundice going on. He's very sleepy with feeds, and he isn't really nursing like he had been. Your milk starts to transition, and you feel really engorged and painful. Your baby's only feeding for about 5 to 10 minutes at each feeding. You aren't able to get your breast to soften between feeds because he's not emptying them. Your breasts stay engorged for about 2 to 3 days. Now your baby's a week old, and he's more alert and starting to feed better, and his bilirubin level has gone down. He's woken up and he's realized he's hungry. You start to worry because it seems like he isn't getting enough when he's breastfeeding. You reach out to a lactation consultant and it's confirmed your breast milk volume isn't adequate for what your baby needs. The lactation consultant helps you figure out a plan to get your breast milk supply in tune with what your baby needs. What happened here? Because your breasts were engorged for several days and not really being emptied at each feeding, due to your baby not feeding vigorously, your body thought it didn't need the breast milk. The engorgement caused suppression of breast milk. The takeaway here is this: you might experience some engorgement when your milk is transitioning, but you want to limit it. You can take over-the-counter non-steroidal anti-inflammatory medication like Motrin to help with breast tissue inflammation. You can use heat before feeding or pumping and use cold for about 10 to 15 minutes after feeding to help with inflammation. And you shouldn't have constantly engorged breasts. Your breast should feel a little fuller at the start of feeds, but the goal isn't to have hard, engorged breasts before feeds. It's not proof that you've got a good supply. Most women whose supply is in tune with what their baby needs aren't having engorged breasts between feeds after the initial transition from colostrum to mature milk. Engorged breasts can also lead to clogged milk ducts. If you notice a spot on your breast that's becoming painful and it often feels like a bruise in the beginning, you want to really focus on the spot and make it your job to get it unclogged. Using heat prior to feeding, having your baby's nose point to the spot during feeding, always starting feeds on the side you have the clogged duct on, and using cold therapy after feeds will help. There are a lot of tips and tricks out there to help with clogged ducts. But remember, you don't want to use a lot of heat and extra stimulation when you're trying to get a duct unclogged. It will be working against you. If you're pumping after a feeding to get the duct unclogged, you're getting more stimulation and increasing your milk supply, which isn't helpful for the clogged duct or the already engorged breast tissue. My favorite method, and usually it works, is to get a bowl of hot water after a feed and put it on a surface. Then you lean over with a 90-degree hinge and dangle your breast in the bowl of water. Gravity and heat help unclog the duct. A lot of women immediately notice the water bowl change from clear to a milky white color. But really, my go-to things are ibuprofen and heat and cold therapy. And you want to try to breastfeed if you can because your baby's going to be more effective at getting the duct unclogged. Mastitis. I'm sure you've heard about it from someone. It can be really painful and very serious. If you notice one or both of your breasts are red and painful, you need to reach out to your OB provider immediately. It's infection of breast tissue. You usually have painful breasts and you feel like you have the flu. Most of the time you have a fever as well. It's really important you don't wait to reach out to your provider. Mastitis can become very serious in as little as a few hours. It can be hard to identify the cause of mastitis, but usually it happens after an untreated blocked duct, bacteria from a cracked nipple, extending breastfeeding intervals, having constantly engorged breasts, wearing a bra or clothing that's too tight, and women with an oversupply have an increased risk of having mastitis. If you find yourself dealing with mastitis, reach out to a lactation consultant for suggestions that can help decrease your risk of having a recurrent episode of mastitis. Let's talk about cracked and bleeding nipples for a minute. My favorite nipple cream is coconut oil. It's a natural antimicrobial and antifungal. You can also express some breast milk at the end of the feeding and spread it over your nipple. You should know, cracked, bleeding nipples are not normal or something to get used to. If you've got cracked or bleeding nipples, you need to reach out to a lactation consultant for a feeding assessment and plan. Your baby's latch may be too shallow, or your baby could have a tongue tie. Tongue ties are being diagnosed more and more. What's my opinion? Tongue ties are often blamed for a bad latch. Sometimes it really is a tongue tie preventing the baby from getting a deep latch. If babies are unable to extend their tongue beyond their lower gum line, or if their tongue is really flat and they can't cup their tongue due to the tongue tie, it can cause major issues with breastfeeding. But many babies with tongue ties latch with no issue. If your baby has a tongue tie, it may or may not affect breastfeeding. All 3 of my babies had tongue ties. They had a posterior tongue tie, which often is harder to diagnose. I had cracked, bleeding nipples each time, and my first 2 babies didn't get their tongue tie clipped, but my 3rd baby did. The difference in breastfeeding was night and day. My 3rd child, Ruth, was very efficient with her feeds after her tongue tie revision. If your baby's taken 45 minutes to feed at every feeding, the latch is painful, you've got trauma to your nipple, or your baby's gaining weight slowly, it's reasonable to have your baby assessed for a tongue tie. Some tongue ties are very easily identified, but others aren't. A pediatric dentist or an ENT doctor are going to be more specialized in this area. It's never wrong to ask for a second opinion. I encourage you to follow your gut here. If you think your baby might have a tongue tie, ask for a referral to see a specialist.